Inserting an airway. When a patient is unconscious, most of their muscles relax. The tongue can fall back in the throat and block the airway. An oral airway prevents the tongue from blocking the airway and allows air to pass. A nasal airway inserted through the nostril reaches into the back of the throat to allow air to pass. This video will show how to insert both an oral airway and a nasal airway. Wear gloves and a mask when inserting an airway. Oral airways go in the mouth and are used when people are completely unconscious and there is no gag reflex. First, determine the correct size. Measure from the corner of the mouth to the earlobe. This airway is too small. This one is the right size. Open the patient's mouth, taking care not to put your fingers between the teeth. Insert the airway with the tip pointed towards the cheek. Rotate it a quarter turn and push it in until the flat part is against the lips. Let's see that step by step. Insert the airway with the curved portion sideways and the tip pointing to the cheek. Then rotate the airway a quarter turn so that the tip now points down the throat and the curve follows the tongue. Push it in until the flat end rests on the patient's lips. Check to be sure the airway is open and the tongue is safely held in place. This woman is regaining consciousness and is uncomfortable with her oral airway. She now needs a nasal airway instead. Use a nasal airway when a patient is semi-conscious or has a gag reflex, but don't use it if there has been head or facial trauma. First, check the nasal passage for any obvious obstruction. Then, determine the right size. Measure from the external portion of the nostril to the bottom of the earlobe. This nasal airway is too big. This one is too small. This one is the right size. The diameter of the tube should not be bigger than the patient's nostril. Next, lubricate the device. Then, lift up the tip of the nose and insert the nasal airway straight into the nostril, pointing it towards the back of the head. Gently push it along the floor of the nose until the flared base rests against the nostril. Here is the insertion again from a different view. Remember, airway devices keep the airway passage open, allowing a person to breathe. Use an oral airway in an unconscious person. Use a nasal airway in a conscious person.